It's official, now confirmed as of Boxing Day, December 26th, the entire province is going into lockdown.
We're asking all Ontarians to stay at home and only leave when absolutely necessary.
The lockdown lasts until January 23rd for all regions south of Sudbury, until January 9th for northern health units. New restrictions include a ban on indoor gatherings and a delay to in-person learning at school. But should the lockdown be coming sooner, and will it last long enough to put a dent in our numbers? For more, I'm joined live by Dr. Sumon Chakrabarti, an infectious diseases physician at Trillium Health Partners. Good morning, doctor. Thanks for joining us today.
Thanks for having me. Good morning.
And I'm just wondering, as someone who is in the thick of this, when you're watching the Premier's announcement yesterday, we'd heard earlier that the rules might go into effect on Christmas Eve. Suddenly, they're pushed back 2 days. What was your first impression?
I was a bit surprised by that. We were all expecting it to be the 24th. I think we all agree that at some point the lockdown in the parts outside of the GTA were important because we saw things were already heating up. Why that extra 2 days, I'm not entirely sure. But to be honest with you, we know that indoor gatherings have been a big driver of this infection, at least earlier on. And lockdowns don't really help that because you can't monitor exactly what people are doing at home, nor really should you. So let's see what happens. I think it will make some effect, but it may not be as big as we expect.
So what do you think we need? What kind of change do we have to drive our numbers down?
There's a lot of stuff that we can't really do in terms of enforcement, in terms of houses, but a lot of things that we are seeing now. One of the biggest drivers of infection is workplace infections. It's happening a lot, especially in my region in Peel, and that's why there are some efforts being looked at. For example, paid sick leave. People don't really want to go home because they're financially unstable and they wouldn't get paid, and also isolation centers. So as many people who can can't isolate at their home, they have 10 or 15 people in there, so then they can spread the infection to their family members. So having isolation centers in Toronto and in Brampton as well could be very helpful.
And I can understand some frustration that some people must feel too who have to go to work. They're being told to cut off all the contact that they possibly can, but they have to go in. That struggle that they must feel, it must be something that hits close to home for you.
I agree with you. There are people who can't work from home. There are people that I think, they're doing things like working in food processing plants, warehouses like Amazon, retail, groceries. These are the people that can't really isolate at home. So when we keep hearing stay home, of course, I think that's important, but it's ignoring this large aspect of the population that can't do that from home. And it is unfortunately resulting in infections, and it's very, very difficult to address.
Now, I'm sure for a lot of families, they're hearing now, okay, so class not returning back to normal after the Christmas break might not come as much of a surprise. They get a bit of a heads up as school was ending at the end of, last week. But I'm just wondering if, the Premier himself says that schools aren't a big problem. Is it worth not sending kids back to class?
We have to be careful with the schools because that can have some unintended effects. I agree with you that with the schools, they're more of a reflection of what's happening in the community as opposed to being a driver themselves. Yeah, there have been the occasional outbreak at schools, but they've been fairly limited. But what we're seeing, though, is that if you now keep students home, this has a ripple effect. You now have parents that have to worry about childcare, and many of them may be essential workers such as doctors, nurses, respiratory technicians, and this can have a problem with the workforce. We have to be careful what we ask for with this, and I do think that maybe having an extra week makes sense, but we don't want to keep them home for too long because of the other unintended consequences.
Something that was said yesterday during the province's modeling presentation, Dr. Brown said that he looks out his window and still sees tons of people. Back in March and April, you'd look out your window and you wouldn't really see people moving around much. That seemed to be maybe a pet peeve of his. Do you have one?
My pet peeve is when masks are worn and they aren't over your nose.
Yeah.
But I agree. When you look, I think that the movement of the population is much different. People were really afraid to touch anything, go outside, and that has changed. There's also other reasons too. There are essential workers that still have to move around. There's other reasons that the movement is different than it was, but certainly that does make a difference. And I think one of the biggest behavioral things that's changed now is people having indoor gatherings. So you're not having a party of 200 people, but if thousands of people are having groups of 5 or 8 people even at home, that can be a driver of infection when you add it all up together.
Now, the big story we've been watching this week has been out of the UK with that new variant. What is it that you're learning about it, and should we be worried about it?
Yeah, this is interesting. So, this is an RNA virus, the coronavirus, and we know that over time it does mutate. And what these mutations mean, it usually is inconsequential. There has been an observation that perhaps this variant is somewhat more transmissible, but it's very difficult to make that determination just looking at the viral genome by itself. You have to have data and watch it for a while to see what actually happens. It could be more prominent in South England for other reasons. So I think it's important to keep an eye on it. I don't think we should panic. And most importantly, this is not going to hinder, based on my speaking with other virologists, our vaccine campaign. I still think the vaccine campaign will bring us out of this pandemic.
And I'm wondering how you can be, I mean, not sure, but that you're leaning towards certainty that the vaccine will still be effective with a new variant. Because I think for a lot of people, they hear it's something new. I wonder if you can kind of calm those fears.
Yeah, and I think that's a very, very valid concern. But one of the big things is what the vaccine targets. It's called the spike protein. It doesn't just make one response to it; it makes multiple responses to it. So even if part of it's changed, that kind of multi-pronged approach to make this neutralizing antibody is only somewhat affected. Now, later on down the road, somewhat like influenza, the vaccine may have to be altered a bit. But by that time, we expect the coronavirus will be more of a seasonal thing as opposed to a pandemic. So I think the most important thing is that the vaccine campaign, it looks like it's still going to be effective. We're still going to get out of this nightmarish situation, but we may need to get more vaccine down the road, somewhat similar to influenza.
Thanks so much for your time today. I really appreciate you sharing your expertise with us.
It's great to be here. Thanks so much for having me. Take care.